quick scripts for medicinal cannabis.
Medical cannabis, the endocannabinoid system, it doesn't play a huge role in the curriculum that we have at medical school. 6 months after I'd qualified as a GP, I started seeing firsthand what a difference it was making to patients. 3 years later, I probably am one of the experts in medical cannabis as well.
Cannabis, medicinal
Medical
cannabis.
Cannabis Commission. A lot of people, they can use small amounts of cannabis.
And there's still a lot of stigma around medicinal cannabis. Patients who worry more about the psychoactive side effect they are on, unfortunately, 5 or 6 medications they've managed to, wean down and actually completely stop. There are other prescription medications being managed purely on medicinal cannabis. I will always address, the elephant in the room. He was actually allowed to keep it with him in his bedside drawer, allowed to actually be taken out to vaporize, which was absolutely unheard of. Purely remote video consultations, fully remote, to reduce the risk of burnout. I do just feel really rejuvenated and I'm just able to give it my all. Medicinal cannabis is legal. We don't have enough of a supply of clinicians and increased access for our patients.
How this might change in the next 10-15 years, you never know. Some of the gems that Sameen drops here may encourage you to take on this field in the future.
Super excited to announce that this episode of Scrubs to Success is supported by the Medical Cannabis Clinicians Society, an independent, not-for-profit network of some of the leading, foremost cannabis medicine experts. Use the exclusive Medic Lunch discount today to join a network of over 600 allied health professionals, pharmacists, medical students, trainees, and even specialists to help ensure you deliver the highest standard of care. Now enjoy the episode.
Yeah, I just want to take it back to the early days. At what point did you realize that medical cannabis was the field of interest for you?
That's a really good question. So it wasn't something necessarily that I had a huge passion for to begin with. You're probably aware, being a medical student, medical cannabis, the endocannabinoid system, it doesn't play a huge role in the curriculum that we have at medical school. And even during my foundation training, even during my GP training, it wasn't something that really I encountered. However, 6 months after I'd qualified as a GP, that's where I started then becoming much more aware of the legal status of medical cannabis. I started seeing firsthand what a difference it was making to patients. And that's where my passion then for it really started to develop. And that's where I started then undergoing my training in being able to consult and prescribe medicinal cannabis for patients alongside specialists. And that's where I would just say it just kind of snowballed. And 3 years later, it's predominantly what I'm doing now as a GP. And I absolutely love what I'm doing.
So is it 3 years now that you would say that you've really been in the field of this? Yep. 3 years. And would you say that you're quite an expert of medical cannabis now?
I'd like
go by that?
I'd like to think so. I've had the chance of working alongside some real experts, specialists, and just the first-hand information I've gained from them, plus patients as well. They are an absolute plethora of information, and just their experiences have just really helped shape my knowledge and experience of medical cannabis as well. So I'd say I'm quite lucky, I can say. I probably am one of the experts in medical cannabis as well.
Yeah, for sure. I think from my experience at medical school, I think it was preclinical years that we touched upon the endocannabinoid system you mentioned. I think that we know that we have receptors for endocannabinoids, but that was really like a very quick sort of dip in and then never really mentioned it again. So hearing this now as a final year medical student at the moment, realizing that there's a field for this and it's becoming, ever growing, it's quite fascinating. So I reckon we should take it back and talk a little bit about cannabis itself. So you being an expert in this, I think it's best to talk about it. What actually is a cannabis molecule? We hear about it as, recreational drugs and also now, prescribed drugs too, but let's take it down to basics. What does it actually do?
Mm-hmm. So cannabis, of course, it's a plant. It's known as cannabis sativa. It's been around for thousands and thousands of years. So even around 10,000 years ago in ancient China, it was being used to treat pain, but also malaria as well. So the plant itself, it's known to have over 500 compounds. Now, they all have different roles, uses, and there's still a lot of research that's going into exactly what role they have and how they interplay with each other. But the two most well-known compounds, you'll have heard of THC, or tetrahydrocannabinol, which is the active substance in cannabis, and then cannabidiol, which is CBD, which has a lesser role, but has a really important role in inflammation and anti-anxiety. So these two compounds play a very important role in the therapeutic effects of cannabis. So medical cannabis was legalized in the UK in November 2018. So even 7 years down the line, the landscape for medical cannabis has changed so much. In terms of cannabis, you were asking, so CBD itself is available in a lot of health and wellness shops, but THC itself, which is the active substance, that's what is required to be prescribed under specialist initiation and then clinical supervision throughout.
So it's slightly different from what you would obtain from the streets.
Yeah, so there are quite a few profound differences between street cannabis, which is used recreationally, and then medicinal cannabis, which is a prescription-only controlled drug. So with recreational or street cannabis, it's very difficult to say exactly what the constituents are. So it's very difficult to know exactly what strain is in there, what percentage THC or even the active substances are. Unfortunately, there's also a lot of contaminants in street cannabis. This can be either in the form of pesticides, but also other illicit substances, which makes it very actually dangerous and unsafe to consume. And of course, street cannabis is also illegal. So in terms of the risk that's being taken to self-medicate or use it recreationally is very high as well. With medicinal cannabis, so these are pharmaceutical grade products. They are produced to very high standards. You know exactly what the origin, strain or cultivar is. You know the percentage THC. You can also get a wide variety of formulations, so not just with THC, but you can get balanced products with THC and CBD, or more CBD dominant flowers with a proportion of THC as well. And the benefit that these products have is that for patients who can be prone to anxiety or have a lot of mental health conditions, they will benefit more from balanced or CBD dominant products, which you wouldn't get the liberty of choosing with street cannabis. Medicinal cannabis is also, of course, legal. So when, as a patient, you're being prescribed it, if you're medicating with it, whether it's at home or in public, you know that you're protected by the legal system and your clinicians when you're using the medication.
So what role do you play in terms of prescribing cannabis? Do you see patients day to day purely on the basis of them requesting medicinal cannabis, or is it just a part of your role? So I believe that you're a GP, and
Yes.
How does this work out day to day?
So day-to-day, so predominantly my role is working as a GP with special interest in medicinal cannabis. So my day-to-day work with patients can really vary. So it can involve either doing the initial kind of triage or consultation with patients. So this will be to discuss what their past medical history is, what their main condition is that they're looking to be treated for, how it affects them, their activities of daily life, as well as what treatments they have tried so far. So in the UK, in order to be eligible for medicinal cannabis prescription, they need to have a confirmed diagnosis of a eligible condition, so something like a chronic pain condition or a mental health condition. And they need to have tried at least several conventional treatments. So conventional either painkillers or physical therapies or talking therapies. These either need to have not worked for the patient, or they might have been intolerant of the significant side effects that a lot of these conventional treatments can have. So if they've tried those, then certainly they can be considered for medicinal cannabis. Because of the strict regulations around medical cannabis, a single clinician can't make the decision to initiate medicinal cannabis for patients. It does involve a multidisciplinary team approach, discussion. We discuss the risks and benefits. We discuss exactly what formulations would be suitable for patients, what strengths, so that we know that the prescriptions that we issue will be the most beneficial for the patient and prove to give them the most clinical benefit whilst keeping the side effect profile really low.
What's the formulation that you'd give this in? Because I only imagine one way, and it's obviously what the general population would think. But what is it that you distribute it as?
So again, the beauty of medicinal cannabis is it's available in a much wider variety of formulations compared to street cannabis. So with medicinal cannabis, of course, you've got the flower or the bud, which is predominantly the most common form that's prescribed. There are other formulations we can prescribe, which are vape cartridges. And then there are also oils or tinctures, which are actually given through the sublingual route. And then there are also edible gummies or pastilles. Now, there are other formulations available abroad in the USA and Canada, so things like subdermal patches, creams, which have a much more localized effect and can be really fantastic for more kind of localized therapeutic effects, especially, for example, in women's health, where you can get localized kind of abdominal cramps or pelvic cramps, especially during the time of the menstruation. So those administrative methods are what we're hopefully looking to bring to the UK and then expand, just so that we can really tailor regimens even more to patients and their specific symptoms.
Yeah, wow. I mean, it sounds so potent, and it seems like it can treat a vast variety of conditions, not just physical but mental as well.
Yep.
And so, what are the primary conditions that you have used medical cannabis for? How much of it does it span different conditions?
Sure. So I just wanted to clarify. So in the UK, so on the NHS, there's a very limited number of conditions that medicinal cannabis is licensed for. So it's only about 3 conditions. So these are severe epilepsy, which is resistant to other treatments. It's chemotherapy-related nausea, and then muscle spasticity in multiple sclerosis. So for that reason, the majority of patients do need to who are eligible do need to seek a medicinal cannabis prescription privately, because the scope for us to prescribe is much larger. So there are 7 main kind of groups of conditions that we can prescribe for privately. So by far, chronic pain is the largest, which we mentioned. So these are conditions like fibromyalgia. It can be neuropathic pain. And then the second category is mental health, like you mentioned as well. So specifically patients who have a history of anxiety and depression, PTSD and OCD. The third category is neurological conditions. I mentioned multiple sclerosis, but also patients who have a history of Parkinson's, Alzheimer's. They can also benefit with medicinal cannabis. The fourth category is women's health. It's patients who have a history of endometriosis, PMDD. So the fifth is gastro conditions, so inflammatory bowel diseases such as Crohn's and ulcerative colitis, and then also IBS. The sixth is palliative care and cancer-related symptoms, so specifically side effects to chemotherapy, nausea, and also the loss of appetite that you can get as a result of those. And the last is sleep disorders and insomnia. And this is just a handful of conditions I've mentioned. There are far more conditions that medicinal cannabis can be prescribed for and probably will be prescribed for in the coming years. So it's an exciting space to be in.
Yeah, for sure. So you've been able to prescribe for all of these kinds of conditions, whereas the NHS only can supervise, 3 conditions. So surely you're wanting this to change in the future. Are you advocating for anything at the moment or doing any research?
Absolutely. Yeah, so you also mentioned my role as a GP. So of course, I'm consulting with patients on a daily basis, and I'm also issuing prescriptions. But aside from just prescribing, I'm also playing a huge role as an advocate, but also an educator for medical cannabis as well. As you can probably imagine, there's still a lot of stigma around medicinal cannabis. A lot of patients, especially, elderly patients or patients from more conservative backgrounds, they tend to worry more about the illicit or the illegal nature of cannabis. They worry about the psychoactive side effects of cannabis as well, and worry about it being a viable treatment option. So as a GP and really a prescriber for medicinal cannabis, we have a huge role in educating patients and increasing awareness. Increasing access is absolutely a huge goal for many of us in the medical cannabis sphere. So at the beginning of 2025, there were 50 to 60,000 active medicinal cannabis patients in the UK. But actually by the end of this year, it's projected to have reached 80,000. Now that's quadrupled just even based off the numbers that we had at the end of 2023. But the data shows that actually up to 1 million patients in the UK could benefit from medicinal cannabis treatments. The issue is that access is limited. Prescriptions can be very expensive. Like I mentioned, a lot of patients have to seek private clinic treatments and prescriptions, which can be expensive. The products themselves, the pricing of the products have to be budgeted for as well as ongoing reviews. So that's definitely a big target for medicinal cannabis kind of clinics and clinicians.
Do you think medicinal cannabis kind of antagonizes the pharmaceutical industry in a way, because the potential benefits of using medicinal cannabis could counteract a lot of the purposes of a lot of drugs that are used these days for so many conditions? And so I don't know if you have any opinions on this, because could that be linked to why it's not being pushed even more these days in day-to-day treatment of conditions?
I think it definitely plays a big role. So for a lot of the conditions that I mentioned, of course, chronic pain, mental health, there are a lot of conventional medications. So opioids, of course, dominate the pharmaceutical industry. They would face a very big loss if patients, predominantly who are prescribed those or were experiencing a lot of side effects. And, we know that opioid medications have a lot of side effects. They can cause cognitive impairment, they can cause severe constipation, and then before you know it, a lot of patients are on polypharmacy, so they're being prescribed additional medications to manage those side effects. And with medicinal cannabis, it's a very safe and very well-tolerated medication. It causes very few side effects, especially because with medicinal cannabis, we're prescribing doses which are much lower than with street cannabis, which again just means that a lot of patients, and again, this is anecdotally, this is from when I do the 6-month reviews with patients. They start off at our clinic and they are on, unfortunately, 5 or 6 medications for the pain or their mental health, plus additional medications to manage those side effects. 6 months, 12 months down the line, once they're stable on a dosage and formulation of medicinal cannabis, along with their GP or their specialist, they've managed to, wean down and actually completely stop their other prescription medications, and their symptoms are being managed purely on medicinal cannabis.
Wow, that's really fascinating. So do you think that much of an impact that medicinal cannabis can have can be the reason why it's not being used?
So absolutely. Like I mentioned, the demand is there. Patients are, there's a significant number of patients who could benefit. Absolutely, pharmaceutical industry will play a very big role. There are more and more medicinal products that are being imported to the UK. It is being cultivated in the UK, which is helping bring the price point down. But the other issue is not just supply of pharmaceuticals, but also supply of healthcare professionals. We don't have enough clinicians who have an awareness of medicinal cannabis, who are trained in prescribing or consulting for it as well. So we could have all the patients, ready at our doorstep. We could have all the products to prescribe for them as well that they could prescribe, that they could benefit from. But if we don't have the clinicians who would be able to assess them for it, initiate it, continue their ongoing monitoring and continue the prescriptions, that at the moment is a very, very big bottleneck. That's a very big restricting factor as well that needs to be tackled. And if we can bring more education about medicinal cannabis, even as not just as a therapeutic medication, but also in terms of a career aspiration from medical school, even as a foundation doctor, even as a GP, that will definitely increase interest, drive, and then motivation for clinicians to enter the sphere. Is still remarkably small.
There's definitely not an explicit pathway at the moment, not the one that I'm aware of anyway, for medical students to go down if they do have an interest in medical cannabis or are at least a little bit curious about it. I can imagine there'll be so many medical students that are curious about this. With the privilege of having you here today, do you have anything that you could advise for the listeners that they could go down to at least open their eyes to the availability to this? Because, I feel like if more awareness, as you said, is put onto this and more research is done, it can really change the world of medicine, to be honest.
Absolutely. So for current medical students who, if they have already heard about it or, if they're hearing about it today and it's piqued their interest, then certainly it's something that I would definitely recommend exploring. One thing I'd recommend is something called the MCCS, or the Medical Cannabis Clinicians Society. So they are a fantastic resource. They actually have a plethora of prescribing guidelines, information about the current regulations, the rules and regulations about medicinal cannabis, but they also have a lot of training materials as well. Their subscription model is actually very affordable. I think for medical students, it's actually £1 for the whole year. So that's something I would definitely recommend for prospective medical students to look into. And they also provide a lot of the training modules and tutorials, which I undertook as a GP. They have one that's really well known called Become a Confident Prescriber in Medicinal Cannabis. So it's a very, very good starting point. In order to develop a special interest in medicinal cannabis, whether as a GP or a specialist, there isn't a clear-cut roadmap. Certainly, it's something that would still require you to become qualified as a GP or as a specialist, and then you can undertake additional training in medicinal cannabis for that background knowledge, especially in terms of the formulations, safe dosing, the side effect profile, how to monitor patients effectively. But a lot of the actual experience and training you'll get will all be kind of first-hand through talking to other specialists and dealing with patients on a day-to-day basis, because what you learn from them, I would say, has been the most kind of eye-opening out of everything I've trained in.
Yeah, for sure. I feel like you've really pioneered this journey, at least, in the UK, with it not being very widely recognized and it only being available in the private sector, largely for many conditions. And so we're entering 2026 next week. What would you like to see by, let's say, 2040, in the sense of how much medicinal cannabis can play a role in this country?
So we've touched on it before. I would say increased access 100% for our patients. So like I mentioned, up to 1 million patients could benefit from medicinal cannabis. If access could be increased for them in an affordable, safe, and a clinician-led and supported way, that I think would be one of probably my biggest kind of aspirations as a clinician in the medicinal cannabis sphere.
For sure. And what does your day-to-day look like? I know we mentioned about what it's like being a GP, but specifically as your role as a clinical director at a private firm that deals with medicinal cannabis and distributes it and prescribes it, are you having to go in person and see these patients and having to do consultations? What does it look like?
So with medicinal cannabis clinics, the ones that exist in the UK, actually, the majority of them are all actually digital health clinics. The reason behind that is because then there's just increased access for patients. So patients anywhere in Scotland, Wales or England will be able to have a consultation and be issued a prescription, if suitable, via purely remote video consultations, which means my job actually as a clinician, as a GP and as clinical director is fully remote at the clinic, and that's what I've been doing for the past 3 years.
And how many patients are you seeing on a daily basis like this?
So depending on the consultations, it can be up to 20 or 25 patients. Because of my role as clinical director and the management aspects that are involved, my clinical work is less now. So it'll be about 1 to 2 days in the week. But I'm seeing between 25 to 30 patients in that time. So that can include an initial consultation, or it can include a 6-month review consultation, plus the plus repeat prescriptions that I'm able to issue as well as part of a shared care agreement with the specialists.
1 to 2 days a week, eh?
Yeah.
So this is something that definitely would have pricked up a lot of ears of the listeners. And is this how your week looks, 1 to 2 days of private healthcare? Do you go back into the GP practices, or do you not do any NHS work?
At the moment, I'm not doing any NHS work at all. I'm purely doing private work. I'll do the occasional kind of locums just to kind of keep my foot in the kind of general clinical world. But this is the majority of what I'm doing, just in terms of the opportunity. That's where my interest truly lies, and just being able to forge my path, in terms of leading a medicinal cannabis clinic in this new kind of era. That's kind of what really gets my juices flowing.
Yeah, for sure. And do you think that having all this time extra, where you're not having to go back into work, helps you in your primary focus, which is, paving this way for medicinal cannabis?
Absolutely. So, as you can probably relate as a student during your A-levels, your GCSEs, your A-levels, medical school, it's always very kind of go, go, go. It's full time. Your schedule is very much packed with lectures, PBL sessions. University of Manchester is a PBL based university, plus exams. And, you're always trying to get additional extracurricular activities or portfolio points or things for your CV, especially if you're applying for specialty training as well. And that was very much my case as well. I was very much full-time until I finished my GP training. And that's when I thought, what will really help me balance my work but also reduce the risk of burnout. There also wasn't much awareness of burnout when I was at medical school as well. And I thought if I want to, be in this for the long game, I needed to make this more work-life friendly. I needed to have time for other interests. I recently got married around the time as well that I qualified as a GP, so I wanted time for my relationship, my friends, other hobbies as well. I developed a very big interest in, my fitness as well, performer Pilates, the gym, that sort of thing. And the beauty of being able to work part-time in medicinal cannabis, but also in a private clinic that's a remote clinic, meant that I was able to then just juggle those things much better. And then as a result, because I'm so much more refreshed and I've got time for my hobbies and my personal time in my relationships, then when I do go into work, I do just feel really rejuvenated, and I'm just able to give it my all. So then even if I have a particularly stressful day, then it's just almost like water off a duck's back, because I know that I'm back to my part-time schedule the next day or in a couple of days. So in terms of from a resilience point of view as well, it just really helps significantly.
Amazing. I had a question just out of my own curiosity, really. So, one particular condition I'm seeing increasing in prevalence quite vastly over the past few years, I feel like everybody's noticing, is ADHD diagnoses. And I work a part-time job alongside medical school where I go into schools and I speak to students, and sometimes I speak to the parents as well. One of the most commonly asked questions I get is, why is my child not focusing? Have they got ADHD? They seem to not be able to, concentrate or be still or anything like this. And I looked more into the ADHD the pathway and how it works. And for one, it takes a long time for a diagnosis to be made. And secondly, the management right now seems to be largely pharmacological. And do you feel like medicinal cannabis could have a role within this?
That's a fantastic question. So similarly, we've also noticed, me as a GP, but also in terms of the patients we consult with, is a very steep rise in the number of not just children but also adults who are being diagnosed with ADHD. And absolutely medicinal cannabis has a role to play in ADHD symptoms. So we mentioned the pharmaceuticals that are commonly prescribed for ADHD. So these are medications like methylphenidate, lisdexamfetamine. They unfortunately can have a lot of side effects, or a lot of patients have reported feeling like being in a very much zombie state. So the quality of life hasn't necessarily been there. With medicinal cannabis, and again, the beauty of being able to prescribe and know exactly where strains come from is that you have two kind of generally speaking categories of medicinal cannabis. You have your sativa flowers and you have your indica flowers. Your sativa flowers tend to be your uplifting daytime flowers. They can significantly actually help patients who struggle with concentration or who tend to report feeling like a jumble of thoughts or feeling really paralyzed at having to decide which task to do first. So sativa flowers can really help with that focus and getting into the zone. And that's what we really prescribe, or that's what we will tailor and prescribe for ADHD patients. And then on the flip side, if in the evening they again struggle to kind of relax, or they're getting a lot of racing thoughts, or they're really struggling to switch off, then the indica flowers, which are much more kind of relaxing, they can also help with insomnia because they can also cause drowsiness. Those flowers can then be prescribed to help with those spectrum of symptoms. And of course, with ADHD, patients can get one category of symptoms or another, or they'll get a complex kind of combination in different proportions. And that's why with medicinal cannabis, based on those flowers and the properties I just mentioned, we can then really tailor their regimen to give them a regimen that best meets their symptoms without the same side effects you can get with the pharmaceuticals that are prescribed for ADHD.
Do you recommend students to do more research within this field to help the area of medicinal cannabis, and also allow them to get a foot into the door as well if they are interested in the field of medicinal cannabis? Do you think getting in touch with people like yourself or other experts within the field and getting research papers done would be something you'd recommend?
Absolutely. So the beauty of with medicinal cannabis, although it's been legal for the past 7 years, there's still so much scope for research. It's still unfortunately massively underfunded in terms of the research aspect. So if there's an option to look into something like this or get involved in medicinal cannabis or the endocannabinoid system at medical school, or if you're intercalating, that will be a fantastic option. I'm absolutely happy to help as a clinician myself if students want to get in touch with myself or other specialists. There are also actually dedicated medicinal cannabis conferences that occur both in the UK and in Europe as well. So Cannabis Europa is a really big one. They have an annual conference specifically in London as well, which again, as a student could be very, very fascinating. It will be not only great to attend like the lectures, but also if you can get a chance to then do a poster presentation or a talk, as well as the networking opportunities that it will provide will just be game changing. So with medicinal cannabis, again, because of the private healthcare aspect of it, the more people you know, the more you put yourself out there, the more you build your personal brand, that will just increase your opportunities for you as well.
What's currently a hot topic at these conferences when you go? What's being discussed in the world of medicinal cannabis?
So at the moment, there's a few different things. So as medicinal cannabis prescriptions and our patient base is growing, unfortunately, some of the issues around that are also growing. So, drug driving offences, or also work kind of tribunals, those cases are also increasing as well. So aside from a clinician, then we do also need a lot of input from lawyers or, legal workers who have then that unique knowledge of the legal system, but also medicinal cannabis rules and regulations as well. And, the police, again, they're getting more education, and then there's more awareness, but we still have a long way to go. So absolutely that right now in terms of increasing awareness, not just in terms of to patients, but for patients and protecting them, that's at the forefront of medicinal cannabis in terms of the news, I'd say, and what I keep hearing kind of cropping up.
Yeah, for sure. And in your day-to-day work, I just wanted to ask you more of like a personal one here.
Okay.
So, obviously, it's still largely stigmatized day to day, and I feel maybe in the medical world too, especially with the NHS only being open to 3 conditions that it can treat at the moment. Yeah. And so when you speak to patients and you're allowing patients to open up about the prospect of potentially utilizing medical cannabis or even their history of using medical cannabis, have you noticed any patterns in the way that the public perception has been and how you may be trying to shift that?
Yep, absolutely. So the majority of patients who come to our clinic, they absolutely, you mentioned, they have a history of self-medicating or they've, used recreational cannabis and found that it was helping them for the medical condition. So for them, they already understand that it works. Now, it's the elderly patients that I absolutely love when they've tried absolutely everything. They've tried conventional treatments, it hasn't worked. And then either a family friend or even their specialist has actually said to them, have you considered medicinal cannabis? And when they come, they're, so hesitant. They have so many questions. They have the stigma that you mentioned. They either associate it with the illicit history that it has or, being caught doing something that they shouldn't be doing. And then they do worry. They worry that even if they are suitable for a prescription, can they openly talk about it with their friends or family or their colleagues or even, for example, other healthcare professionals as well. But I love really talking about it openly. Even in my consultations, I will always address, the elephant in the room. If they have any reservations, if they have anything they're worried about, I always want to address that right at the start. Because at the end of the day, with medicinal cannabis, it's being prescribed for a medical reason. So in the same way that opioids or the ADHD medications or cancer treatments are prescribed for a patient, they are absolutely legally entitled to this medication and to be able to take it as prescribed. And as patients, that's their absolute right. So empowering them is a really big part of what I like to do as a clinician. In terms of the stigma you mentioned, so it's absolutely fine to use your medication outdoors as well in designated spaces. A really fantastic story I heard from a patient recently was they actually had a hospital inpatient stay for a major abdominal surgery. Now, the hospital team, the patient had explained to the anaesthetist at the pre-op assessment and the hospital team that they were prescribed medicinal cannabis. And he was actually allowed to keep it with him in his bedside drawer on the ward. And he was allowed to actually be taken out to the designated areas to vaporize his medicinal cannabis flower, which was absolutely unheard of. I've heard, unfortunately, horror stories where patients have had the medications taken off them or have been told by the nurses that they can't have them with their bedside or that they can't actually even medicate. So hearing this story, so this patient actually emailed us in to say that this had been his recent experience it was fantastic. So I'm really hoping that, again, as the awareness grows, that patients are able to medicate as is their right and that they don't feel like, criminals for using their entitled medications. So as clinical director, so aside from the 1 to 2 days of clinical work that I do, then the rest of my work schedule, which will be for another day or day and a half, is more managerial duties. So it will be things like overseeing the prescribing team. So we have pharmacist prescribers, we have nurse practitioners. It'll be overseeing or answering either any prescription questions that they have or any clinical queries. The multidisciplinary team that I mentioned as well. So we have a meeting every week where the cases are presented. We have a back and forth discussion with the specialists, other doctors, about whether patients are suitable, whether they have a clear unmet clinical need, and if medical cannabis would be in their best interests. And then, for example, clinical auditing is a very, very big part of what we need to do, especially being regulated by the CQC. There's a lot of audit work that needs to be undertaken. I'm involved in overseeing that and just checking that we're clinically compliant as a clinic as well. A lot of medicinal cannabis clinics, they're under a lot of scrutiny. We have to make sure that we're prescribing safely and appropriately for our patients because it is, of course, a Schedule II drug, so it's a very heavily controlled drug at the end of the day that we're prescribing.
Amazing. I had one burning question actually
Sure.
from before I wanted to ask you. So it touches upon before when we spoke about cannabinoid receptors. Be a quick question. But when I was doing research on cannabis and the cannabis molecule itself and how it acts in the body, I realized that we endogenously produce cannabinoid molecules. So evolutionarily speaking, we are supposed to sort of secrete this, and we have receptors for cannabis as well. So does this add a further argument to suggest that it is a more of a natural treatment or remedy for certain conditions and just lifestyle in general?
Absolutely. So you mentioned the endogenous molecule, so anandamide, 2-AG. These are endocannabinoids that naturally exist in the human body. And with the endocannabinoid system and the receptors that we have, so we're talking about the CB1 and the CB2 receptors. So the CB1 receptors, they're present in the brain and then the spine. The CB2 receptors, they're present in the peripheral and the immune tissues. And cannabis, so specifically the THC that I mentioned earlier, so that the active substance in cannabis, so that's actually a partial agonist of CB1 and CB2 receptors. And that's how then we produce the analgesic, the anti-anxiety, and then the sleep regulating components or the sleep regulating aspects of medicinal cannabis. So absolutely, when patients who have been self-medicating for a long time and they've been fighting for medicinal cannabis to become legalized in the first place in the UK, that was one of the biggest arguments, that medicinal cannabis, it is a very natural, not only natural existing plant, but because of the endocannabinoids that exist in us as well, there is that synergistic effect that you're getting with that medication that you don't get with other pharmaceutical medications that are produced in a lab.
Yeah, I mean, anandamide you mentioned translates literally to the bliss molecule. And so
Yes.
creating bliss in the body and in the mind as well. We're treating physical ailments as well as mental health related ailments. How does it, attend to both types of conditions? Do you know anything about this?
Yeah, so similarly, you mentioned, the bliss molecule, but also the CBD aspect in THC. So CBD also works and interacts with other neurotransmitters. So we've got serotonin and dopamine, which, serotonin we like to call a happy hormone as well. So absolutely. So whilst THC can act and give us the pain relieving aspects, the CBD will play and have more of a synergistic effect and help with the anti-anxiety, the anti-inflammatory, and will also counteract the psychoactive side effects you can get with THC. Aside from that, in cannabis, we have, like I mentioned, almost 500 different components. So there's more and more research that's gone into the additional compounds. So we've got other cannabinoids, we've got flavonoids, we've got terpenes. They all play an important role in something called the entourage effect, where the way that they interplay and enhance the effects of each other can be massively tailored. It's not all just about the THC number or the strength. So the highest strength doesn't necessarily mean it'll be the most beneficial. It's all these additional cannabinoids which can really help unlock other potentials of medicinal cannabis. And we're literally just getting started. There's so much more to it that's coming. It's really exciting.
Wow, that is so fascinating. The entourage effect also,
Yeah.
Wow, brilliant. So yeah, I think unfortunately I have to wrap up just because of time, but it's been an absolute pleasure, Dr. Sameen. Is there any final messages you'd like to say to the audience, primarily medical students, maybe a message of hope for the future, especially with the field that you're paving?
Thank you so much for having me on today. I just wanted to say to medical students out there, medicinal cannabis is legal. We can definitely, everyone will have such a huge role in improving access. If listening to what we've discussed today has piqued your interest, then please check out, like I mentioned, the MCCS website. They're just a really great source of information and training. And, speak to other specialists. I'm happy for students to contact me as well. It's not for everyone, absolutely, but if it's something that could work with either your interests or your lifestyle, I mentioned the part-time aspects, the remote work that can come with it as well as the networking opportunities to get in the private sector, then there's definitely a huge potential. And like I mentioned, we don't have enough of a supply of clinicians and medical professionals. So as many students who are interested and will pursue it now, we're only going to be able to then increase access for our patients.